Yo, what's up, YouTube? Welcome back to episode number 9 of COVID-19 and the impact that it has on the body, specifically body systems. I can't believe we're already on episode number 9, man. It's ridiculous. I feel like I just started. But anyway, today's episode, we're going to be talking about the endocrine system. Now, what the endocrine system is, of course, the endocrine system actually is in charge of all of our hormones in the body. So everything in our body. It also includes the glands in our body. And the glands, I want to make sure I get this right, is the adrenal, pineal, thyroid, parathyroid, and the pituitary gland, which is actually the master gland in the body, of course. And it also includes the hypothalamus, ovaries, and testes as well. That's also a part of the system. Now, what this system actually does, it secretes all of the hormones into the body, releases them actually into the bloodstream, lets them work their course and do whatever it is that needs to be done at that given moment in our body. So this system mainly deals with different moods, growth or development, and actually metabolism and reproduction. So different hormones, it's different emotions, whatever mood you're in, whether it be reproduction of a child, whether you're angry, you're sad, whatever it is, that's different hormones working at that given moment. That's what is going on. Now, COVID-19. What does COVID-19 do to the endocrine system? Just like any other system, the endocrine system is sadly, it's not safe from COVID at all. Now, COVID-19 actually has a major effect on the system just because it does deal with specific things like the adrenal glands and just different hormones. I'm actually going to use the adrenal glands as an example just to give you an idea. Now, first, actually, when COVID enters the endocrine system, it binds to something called the ACE2 receptor. What that is an enzyme cell, and for some reason, COVID latches onto these very well. There's a couple receptors, I believe. There's one of the reproductive system. I think there's one of the respiratory system. Don't quote me on that. And then there's also one, of course, in our enzyme system or endocrine system, and that is what COVID, of course, latches onto. So now, moving back to the example, I said here in my paper, for example, if people with adrenal insufficiency have COVID, the infection will strike a lot harder for them because the adrenal glands, what they're supposed to do is produce enough cortisol for the body, or cortisol, depending on how you pronounce it personally. COVID will actually come in and ruin the production, and it won't be able to produce as much as it needs to. People with diabetes as well, this is just an example, of course, pre-existing conditions, they are at a higher risk. Now, people with diabetes, of course, COVID also affects them a lot as well because it also disrupts the level or the amount of insulin that's actually being produced. And this can cause extreme glucose levels in certain patients depending on what their health activities are, what they've done, how their body reacts to certain things, and just kind of their past history when it comes to their health itself. So another thing that doctors have found is a vitamin D deficiency, and that's also you're also at a higher risk of getting the disease if that happens. So it is definitely unfortunate, and there's a lot of things that COVID can do, and it's so mind-boggling, especially when you do a lot of research. Like, I have researched all of the systems. I've researched vaccines. I've made my own, I've done a lot of stuff, made my own mask, and we'll get to this stuff later, of course, but it's actually ridiculous. Now, with the endocrine system, the treatment methods are pretty much the same, but there's a little bit of difference, just because of how COVID attacks the endocrine system. There's only so much that can be done, and I don't mean to repeat myself, I really don't, but that's how COVID works. COVID is it's unusual. It strikes in certain places that the body can only catch up so quickly with, and it's actually ridiculous. Now, specifically with people for certain pre-existing conditions like diabetes and things of that nature, that's where the doctors once again have to discuss, do we up their dosage on this? Do we take it away? I mean, we can't take it away. Like, the diabetes need to be taken care of. So do we lower what do we do? And that really depends on the conversation you have with the doctor. Some of the things that you can do, of course, is take certain medications to kind of calm everything down. As well, a lot of doctors actually perform many studies with the patient's body and their medicine intake. And after what that study actually does, it shows them how much medicine, okay, this person can take this amount. So with that being said, we're going to prescribe them this amount of medicine. Hey, take this so many times a day, whether it be once, twice, 3 times a day, depending on the doses they give you. So that's one of the things that can be done, definitely. So Take that into consideration, as well as just overall trying to breathe and relax, avoid any stress or anxiety. I know it's easier said than done, especially with having something as severe as COVID. But of course, this you can't really do much. So extra caution should be taken with any medicine that it involves COVID and a pre-existing condition, just because if you have something like diabetes and the coronavirus, you do not want these to intertwine with each other, just because COVID will definitely win that fight, and diabetes also kind of goes against you as well. So now you have two phenomena that you're taking on at one time, and you have to be very careful with your medicine, because you're trying to take an intake that will take care of both of them, keep this one level, get this one out of the body completely. So definitely be careful. Also, like I said, healthy diet. Feed your body, give your body that nutrition, get it stronger, get the immune system stronger. Because even though it's in the endocrine system, the immune system will still try to fight and build and respond to that COVID and try to fight it out of the body. So now you have that fighting it, as well as this medicine kind of being worked around with it. So a lot of good things are happening just with a good, healthy intake. Try to breathe and relax, and overall stay safe. Don't, social distance or whatever it is that you need to be done in your area. But that will conclude episode number 9. Thank you all so much for the support. I do appreciate it. And give me a comment. Let me know what system I should do next. So without further ado, we are going to cut it off here, and I'll see you guys in the next episode. Peace.